Go ahead, sir.
Hello, a very good evening. I'm Dr. Nilesh Balkawade, Clinical Head, Oasis Fertility, Pune. Today, we are going to talk on a topic which is related to empowerment of women, liberating women from the fear of infertility. Friends, we just celebrated International Women's Day on 8th of March, and as we all know that it's not about celebrating one day, it's about paying respect to the most important person in our life, the woman in our life. May it be our daughter, our mother, or our wife. The woman plays a very important part in our lives, and therefore we should have these women in forefront in each and every aspect of life. Why should women only face the problem of infertility? Why should they have the fear of infertility? It's time to break the shackles. It's time to go on. It's time to believe that not only women but also men are responsible for infertility. We need to pass on the message. We to the couple. We need to pass on the message to the society that couple as a whole is responsible for infertility, or maybe they have their own reasons for infertility. But woman needs to get liberated from infertility. Friends, this is a social problem, and we all know that one in six couples in India are facing the problem of infertility, and many are visiting our infertility clinics. Some have a shorter duration of infertility, some have years to go, and they have longer durations of infertility. And therefore, it's very hard for these women to just go on with this problem of infertility. First and foremost thing is that they are internally facing a very tough situation of not being able to conceive in that every single month. So every single menstrual cycle coming, they'll have the same stress related to infertility if they are trying. Secondly, the a couple might have certain issues in between themselves, and there can be problems, and therefore there can be marital issues related to infertility. The family as a whole can have certain issues. There can be pressures from within the family, from nearby friends, relatives, who keep on constantly asking, especially that woman, that what about your fertility issue. And then there can be societal issues where people look in a different way to a woman, uh, even in this 21st century, who are not able to conceive. So this mindset has to be changed. We need to gather up, we need to come together to withstand this, and we need to give her the support, give the woman the support in the form of treatment, in the form of empathy, in the form of psychological counseling, improving the societal issues. The problem within the society should be managed. The society as a whole should stand behind a woman. All these factors are there. Today I'll be going to talk about the psychological aspects and the treatment part of infertility. Friends, things have improved, and so has the treatment of infertility. Today, many of our patients of infertility are able to conceive, and there is only a few numbers which are uh, not able to conceive even after higher end treatments. But believe me that diagnostic techniques have improved, the management plans have improved, the therapeutic regimens or the treatment plans have improved, and all this has extremely being very easy to procure. You can just walk in a center, take your first consultation, and then your plan for your fertility is ready. So your diet, your exercise plan, rest, uh, then medicines, all this along with your treatment plan, what is the treatment you're going to undertake for infertility, is already in one go. So at Oasis Fertility, we usually have a couple counseling in the first go, assess their previous issues, try to see if there are certain new issues, try to see the diagnosis. So this can be done by very few simple tests which are non-invasive, don't cause any harm. And once these tests are available, we can counsel the couple regarding their exact cause of infertility. Once we find the cause of infertility, maybe it be in the uterine factor, cervical factor, tubal factor, ovarian factor, or in the sperms, we can have issues with the sperm count, motility, morphology, or any problems with the sexual drive. All these problems can be known in the first visit and the test subsequently. Once we are through with our diagnosis, then we can form a treatment plan for the patient in the coming days, coming months, and in the coming year. As per the severity of the problem, this can be planned, and the exact treatment of infertility would depend upon age of the woman, duration of infertility, her current AMH or antral follicle count, which will be indicated by the ovarian reserve, the tubal patency, the semen analysis, and so on. All this will decide the exact approach or the exact treatment to be undertaken. If the duration of infertility is less, and if there is no major issue in all these tests, probably a natural try or ovulation induction can be tried in these couples, and then they can be advised a healthy lifestyle along with this. Along with that, there can be alternative regimens or alternative methods like intrauterine insemination, where we can improve the success rates over and above the natural try. So where there are mild to moderate sexual dysfunctions, then male subfertility in the form of less sperm count or less motility, then in these patients we can go for IUI. Also, where there is vaginismus or sexual dysfunction in either couple, then again we can go for a intrauterine insemination. Then in unexplained infertility, where we know that there is no obvious cause, but there can be minor cause which is not being able to seen in the test. In these patients also we can go for an IUI treatment. Friends, these treatments are the basic treatments. Along with that, we can have certain specific answers to certain specific queries. So if a patient is suffering for PCOS or endometriosis or uterine fibroids, or for that matter poor ovarian reserve, severe oligospermia, varicocele, these do have specific treatments, and these needs to be managed first before we go in for other treatments. So advanced fertility options or advanced treatments like the artificial reproductive techniques in the form of IUI and IVF should only be undertaken once the basic cause is analyzed and the basic cause is tried to be treated. Once we are treated the basic cause and still the patient is not able to conceive, natural try has been done, IUI has been done, and still the patient is not able to conceive, we have an option of IVF or ICSI. Also, for those patients who have severe female or male fertility problems in the form of very low reserve, tubal factor, bilateral tubal blockage, cervical factor, where IUI is not possible, all these patients can get treated by IVF or ICSI. Above that, there can be severe male factor infertility in the form of severe oligoasthenoteratospermia, where the sperm count is very, very less, the motility is very, very less. In those patients, they cannot conceive naturally or maybe even by IUI. Such patients can take the advanced treatment in the form of IVF or ICSI. Those couples who have had conception but were not able to continue that because of recurrent miscarriages, for those patients IVF along with genetic testing of the embryo is another option which is coming up. Those patients who have a previously chromosomally abnormal child or single gene disorders in the previous child or in the family, then these patients can undertake IVF along with PGTM as a modality of treatment. There are many forms of treatments for treating the infertile man, like if the are having certain issues, we can treat those issues by uh, using sperm selection techniques, different sperm washing techniques, and so on. Those couples who have severe oligoasthenoteratospermia, or they are having azoospermia, which is obstructive testicular sperm aspiration, can help. When there is a non-obstructive azoospermia, microsurgical testicular sperm extraction can help. So these are n number of methods which are available to give the highest possible level of treatment. In women who have a very low egg reserve, we have options such as PRP and stem cells, which are coming up, along with changed protocols for IVF. So uh, sky is the limit. Things are improving, and we are going towards more and more success in cases of infertile couples. And with this, I also need to highlight the psychological support which is needed. So we all talked about uh, breaking the shackles of infertility and liberating a woman from her infertile problems on the eve of this woman's day. We also need to understand that they need a mental support, they need a psychological support, and this can be given by the treating physicians. But nonetheless, the family is also important. The partner is important, where they can support the wife, or the wife can support her husband in this treatment, during this treatment of infertility. Any of them can have a problem, but the support from the partner is very important. The support from family is also important. The family also comes to come needs to come in picture. If the problem is severe, the family is uh, positive enough about discussing all these issues, they can come up for a group discussion, and the doctors can discuss with the family. And if the family is involved, the couple or the woman feels protected, and this can help her to get rid of her psychological issues at least. Along with that, the society also, per se, there should be awareness that this problem is solvable. And therefore, as fertility specialist and at Oasis Fertility, we are launching this more and more awareness drives in the society, and this Facebook drive is one aspect of that. So, friends, infertility, although it's a growing problem day by day, we need to understand that most of the times, many of the situations, we can treat this infertility by simple or other advanced treatments. But we need to give a rationalized, proper, methodical approach to the couple. And for the woman, as it is said that treating her by medicines is also important, but more than that, giving her psychological support is going to be re- really needed in these days, where the stress levels are increasing, not only because of infertility but because of other issues as well. So thank you for your patient hearing. If you have any issues related to infertility, do connect with us at Oasis Fertility Pune, and we have our centers at Wakad and Kharadi. Please log into our helpline number. You can call the helpline which is given below. You can call anytime and connect with us, or you can leave comments on this video, and we will connect back to you. So thank you for now. If any issues, do connect. Signing off for now. I'm Dr. Nilesh Balkawade. Thank you.